Good afternoon, Your Excellencies, ladies and gentlemen. Thank you so much for being here. My name is Sanjay Gupta. I'm the Chief Medical Correspondent for CNN. It's a real honor to be here and to have this particular topic on the agenda. For many, they believe it's one of the biggest health challenges now around the world. When many people think about global health, they still think primarily of infectious diseases such as HIV/AIDS, malaria, and tuberculosis. And for good reasons. They continue to be a significant problem and challenge in many remote places around the world. But we know that chronic diseases or non-communicable diseases, NCDs, cause more than 60% of deaths around the world, of which 80% are in the developing world. And that's part of the reason that we're all here today. Now, as a global health reporter, I have seen a lot of this firsthand. Significant rates of heart disease in Peru, diabetes in India, cancer in Southeast Asia, exactly how to deal with these problems, exactly what the solutions will be as part of what we're going to be discussing today. China alone is going to lose around $600 billion over the next 10 years in foregone national income due to heart disease, diabetes, and stroke, again, over the next 10 years. And of course, all of these numbers that we hear about and that will be discussed today say nothing of the personal hardship that people suffer, disability, inability to be productive, members of their families or society, or the suffering and pain that is often associated with these chronic diseases. As things stand now, roughly about 3% of developmental assistance goes toward chronic disease specifically, about 3%, despite a lot of the numbers that you just heard. And again, we're going to talk about that and talk about some of the solutions. The core question that we're really trying to answer and that we're going to pose to our panel as well is how should the public and private sectors work together to combat diabetes, cancer, heart and lung disease? So that's a question I want you to sort of keep in the back of your minds as well. Today we're going to hear from all of our panelists, and then we want to encourage you as well to join in the discussion. There'll be microphones passed around. Feel free to grab one. If you could say your name and organization that you're with prior to asking your question. Please help me welcome our panel, which I think is the perfect panel to talk about this. Obviously, Secretary General Ban Ki-moon, United Nations, New York. Ken Powell, he's Chairman and Chief Executive Officer of General Mills USA. Paul Jacobs, Chairman and Chief Executive of Qualcomm USA. Julio Frenk, who's Dean of Harvard School of Public Health, and Richard Clark, Chairman and Chief Executive Officer of Merck. Please welcome them.
Thank you, Dr. Sanjay Gupta, distinguished panelists, Excellencies, ladies and gentlemen. I'm very much pleased to participate in this very important gathering when we are discussing one of the most important priority agendas of the United Nations, the non-communicable disease. No one talks these days much about smallpox anymore. The last victim died 3 decades ago, but I remember smallpox every time I face a major public health challenge. Because smallpox showed that even the most fearsome disease killer can be defeated. There are more recent examples. The Millennium Development Goals ushered in unprecedented cooperation and progress on infectious diseases. Our campaign against HIV/AIDS is saving lives by bringing together government, civil society, and industry, including many of you in this room. Non-communicable diseases deserve similar attention. Six out of every 10 people die from cancer, diabetes, chronic lung diseases, or cardiovascular illness. 35 million people die every year. The problem is grave and growing. Already heart disease, stroke, and diabetes are estimated to cost low and middle income countries as much as 5% of GDP. By 2030, chronic disease-related death in Africa, the Middle East, the Southeast Asia will grow by more than 50%. Globally, diabetes death will increase by 2/3. chronic diseases used to be seen as a rich man's problem. Not anymore. Unhealthy lifestyles are going global. 85% of people who die from non-communicable diseases are in the developing world. In developed countries, measures like early detection that prolong life are common. Not so in developing countries, where health systems are generally weak and geared to infectious diseases. We cannot allow chronic diseases to even further amplify the health challenges faced by developing countries, especially when we know the solutions. This is why the United Nations General Assembly will hold a high-level meeting on the prevention and control of non-communicable diseases in September in New York. I commend the Caribbean states, which have seen this threat grow, for showing welcome leadership in pushing for this session. The meeting is for heads of state and government, officials from across their cabinets, educators, and media. Success requires public-private partnerships. It requires a political vision and resource mobilization across sectors, across ministries, and across borders. We also need businesses to be there in full force, and not just the health ministry and health industries. Certainly, we want to work more closely with the pharmaceutical companies to make medicines more affordable and accessible. But we will also look to food companies to cut back on the salt, trans fats, and sugar, and be more responsible in marketing products to children and providing accurate information on their products. And virtually all industries can help reduce pollution and promote healthy lifestyles. To the business executives here, let me say, the well-being of your workforces, your very productivity and reputation are all at stake in working for global public health. The summit in September in New York is our chance to broker an international commitment that puts non-communicable diseases high on the development agenda, where they belong. Today's session is just a start. Let us lay the groundwork for success in September summit meeting in the United Nations to address this very important and serious issue. Thank you very much.
Over to me?
Yep.
Okay. Well, I'm Ken Powell, CEO of General Mills, and very happy to represent the food industry today. And since the Secretary General, I think, has gone through some of the really worrying statistics on NCDs very, very well, I'm just going to jump right to what the industry is doing. And I think what I'll begin by saying we understand that clearly the huge role that diet plays, and that a company-by-company approach is not going to work here. Clearly, collaboration across industry is very, very crucial. And what I want to do is give you a few examples of how that's happening and the kinds of goals that we're setting for ourselves. So, for instance, 4 years ago, the industry formed the International Food and Beverage Alliance, or so-called IFBA, which is composed of some of the largest food companies in the world. And the mission of IFBA is to support the 2004 WH goals around diet, physical fitness, and health. And so the commitments that we've made align very, very much with those goals. So one of the important commitments is to improve the health profile of the products that we make through reformulation and the composition of those products, focusing, as you heard from the Secretary General, on fat and trans fat, sodium, sugar, and reducing these things in the food over time. There have been most recently in the U.S., over 20,000 products reformulated over the last several years. So there's good engagement on this now. The industry in the U.S. recently announced a commitment to reduce sodium by 20% in core products over the next 5 years. So good progress there. There's also a commitment on advertising to children. Members of IFPA do not advertise products to children less than 12 unless those products have the appropriate health profile. Another key part of what we're doing is this whole area of exercise, workplace wellness is an important part of our commitment. This is also an interest of the World Economic Forum with the Workplace Wellness Alliance that will be announced this week. And there's huge potential, I think, for industry to play a leadership role here. Also, commitments in the area of nutrition information. Again, mentioned by the Secretary General just recently in the U.S. 2 announcements, one by Walmart and their effort in the area of consumer communication on PAC, and then the Industry Alliance in the U.S. announcing a program called Nutrition Keys, which is putting essential information on the front of the pack. So I think very good initiatives through IFPA. Many of these echoed in the First Lady's Let's Move initiative in the U.S. First Lady Obama, focusing on many of the same things. Also, she has a high focus on physical activity. So some of the same themes in some very cooperative organizations around the world.
Mr. Clark.
Thank you. Dick Clark from Merck. Certainly from an industry standpoint, it's important that we continue to focus on improving health in a general sense. And the first issue we have to really concentrate on is the industry must continue to support innovation to make sure that we improve the cost effectiveness of treatment and to focus our capabilities on preventive capabilities in issues that face chronic diseases. So that's very important for us as an industry to be able to do that. Just as important as that, it's important to think about the collaboration and cooperation that needs to take place within our industry for international partnerships on innovation, to be able to bring the healthcare intellectual capabilities together, to bring information technology into the picture as well, and obviously then to bring all of these partnerships together. So it goes beyond just medicines and vaccines. It's a stronger, more powerful definition of what healthcare improvement is for chronic disease, and our industry must take a leadership position in accomplishing that. The final part, which has been discussed, is what do we do as employers? So the ability to have wellness programs in place within your place of employment to help educate your employees, to be able to take that to the next step is important. And why we feel confident that we can participate in that, many of the activities that I just mentioned, we also provided with the HIV/AIDS activities for the last decade or so, and we can see the improvement in HIV/AIDS treatment, we can see the improvement in education, we can see the improvement in infrastructure that it takes from a healthcare standpoint to make that improvement that we've seen. We can do the same thing with chronic diseases.
So I'm Paul Jacobs, and I run Qualcomm, and you might say, what's a cell phone company doing on a chronic disease panel? But I'm also chairing the Telecom Industry Global Agenda Council, and one of the areas that we focused on is using wireless technology as a key enabler and focused in on healthcare as an opportunity. And the reason is because the wireless communications can provide a real-time link and can actually close the loop. And we like to joke a little bit that, take 2 pills and call me in the morning. That's a slower feedback loop than you can get from a device that you have with you all the time. So we can, by focusing in on things like chronic disease, which, as the Secretary General said, is such a huge issue, both around the world, but really in particular in the developing world, we can improve treatment, compliance, and outcomes. And there are devices already in the market that are doing this, so this isn't a pipe dream. We're working with a number of companies, one which does cardiac arrhythmia detection with sensors that are worn on the body, connected to a device that then monitors and connects back to a monitoring center. And this has already been shown in clinical studies to be 3 times more effective than the traditional way of finding out these cardiac arrhythmias, which was putting somebody in an ICU bed. Now, it's obvious why, because the person's walking around and actually exercising their heart, not to mention the fact that they're more free and able to go about their lives. There's also, in the case of diabetes, a lot of work being done on using wireless technology and people building glucometers that actually have wireless devices in them. We're running a program in Mexico. There's over 1.2 million people with diabetes around the border, U.S. and Mexico, and we're actually helping a government a clinic in Tijuana treat people so they have healthcare workers who are somewhat lower skilled who will go out into the community and actually help people take care, educate them, give them devices to monitor their glucose levels, contact them back, and we're doing a study to see exactly how much better can we provide treatment, how much better can we scale the fact that this clinic is vastly overloaded with patients and isn't able to give the kind of care that they want. And so, the kinds of issues that we're running into are issues of regulatory burden. It is the case that if you take a standard cell phone and you connect a wireless sensor to it that you would wear on your body and you use that for treatment or diagnosis, the FDA says that is a medical device, and therefore that standard cell phone has to go through an approval process. That seems a little off to us, and we've had some work between the FCC and the FDA to go through and see whether they can make that, reduce that burden. And also just the question of payment for these kinds of telehealth, telemedicine, mobile health things. So the result, I think, is that we're going to see mobile health actually roll out more strongly in the developing markets. We have a lot of work going on, for example, in India, and then may actually then come back to the developed countries where it's also needed. But I think that in a few years, it will be the case that, as today, you feel like you're connected with your friends and family because you have your cell phone with you, not because you're talking to them, but because you could. In the future, you'll feel the same way about your health professional. Not that they're always monitoring you, but they can in case something goes wrong.
As you point out, I introduced Julio Frenk as the Dean of the School of Public Health at Harvard. And his previous role, worth mentioning, between 2000 and 2006, was Minister of Health of Mexico as well, which is relevant to this conversation.
Thank you very much. The session today, I believe, is truly a turning point in the debate on global health, because it's getting us away from this old dichotomy that you have the problems of poor people, mostly communicable diseases, and the problems of rich people, mostly the non-communicable. And we're understanding that in the developing world, there is now a double burden of disease that's fully entrenched. There's still an unfinished agenda, but there's these emerging issues that are rapidly becoming not just a public health crisis, but indeed a development, an economic development crisis. And I would even pose a security crisis in the sense that they create very serious problems of injustice around the world. I'm very happy to participate both in my role as Dean of a university and therefore bring the voice of civil society, but also in my previous role as Minister of Health of a developing country which is already facing this double burden in a major way, Mexico, and probably more important, in a third role, which is as a person who has been living in his family with a chronic disease, because when my wife, who's here in the audience, was diagnosed with breast cancer in 2007, I had the opportunity, after having studied health systems all my life and having led a Ministry of Health, to actually look at the health system from the perspective of the patients who suffer a chronic disease, talking with a lot of them, becoming an accompanying spouse, and getting the insight as to what it is to live with a communicable disease, a non-communicable disease, a chronic disease in a developing country. And what I have found after this reflection is that we still need to deal with 4 fundamental myths that are out there around the challenge of chronic non-communicable diseases. The first myth is that this is not an important problem for developing countries, because there's still the overwhelming burden of infectious diseases. The second is, well, even if it's important, these countries don't have the infrastructure to deal with them. It's much too complex. The third is, well, even if there are things we could do, it's too costly. We just can't afford it. And the fourth myth is, if we do this, it's it's going to take away from other priorities. We're going to lose the focus, and we're going to stop investing in other priorities like AIDS, malaria, or TB. Well, here in this same place, in Davos, about a decade ago, in the late 90s, we started having sessions on AIDS. And at that point, the same four myths were around. Well, it's not that important. It turned out to be a major global health crisis. Well, there's very little we can do. Antiretrovirals came into the scene. Oh, but they're too expensive. After a decade of building a global coalition, there's 5.5 million of the poorest people in the world on treatment. And then finally, it's going to take money away from other things. Quite the opposite. The attention given to this problem helped to increase the visibility of health in the agenda. I think we're exactly at that juncture now with non-communicable diseases. We need to demolish the four myths and make it clear that A, diseases are very important, and I think the numbers you've heard are eloquent, but B, that there's a lot we can do in a comprehensive strategy, going from upstream interventions to deal with the determinants, and the role of industry here is very important. The role of civil society in engaging in more healthy lifestyles is crucial, but also looking at the whole spectrum of access to timely diagnosis, secondary prevention, and treatment, because there's a lot we can do. And then it is affordable. What we see today are huge gaps. There's what I would call the 580 financial disequilibrium, for example, in the case of global financing of cancer. 80% of the burden of disease is in developing country, but only 5% of financial resources are in developing country. There's a huge room there to improve. And there's a lot we can do. Many of the diseases that we're talking about are amenable to prevention. We have some specific prevention, certain vaccines, like for example against cervical cancer, where 93% of deaths happen in poor countries. We have opportune treatment for a number of these diseases where there's no clear prevention. And here's again where we have an enormous sense of injustice, just like the one that emerged with problems like AIDS or with malaria or TB, problems that only affect poor. These are problems of the whole country. But today, for many of the non-communicable diseases, dying from the disease, becoming completely ruined because of lack of coverage and paying every last penny because of treatment of that disease, or suffering because of lack of access to such simple things as pain palliation, those are becoming problems that only affect the poor. And I'll end up with a striking number. If we look at childhood cancers, leukemias, we have what I would call the 90% disparity. In rich countries, for example in Canada, 90% of those cases can be cured. In the poorest 25 countries of the world, 90% of those children will die. And this sense of fundamental injustice, that we have the means, but we're just not allocating the resources, is something I hope that the Secretary General's leadership in convening this high-level special session will help us to address. We need to leapfrog, learn from the lessons of the HIV/AIDS movement, and make it clear that non-communicable diseases are today an integral part of the global health agenda, that it can be done, that there are many examples of innovations with the involvement of industry and the very active participation of civil society. There's evidence that we can actually tackle this emerging crisis.
Great, thank you. We're going to allow the panel to ask questions of each other, and also, obviously, again, you to ask questions. But I'll start off with a couple. Ken, when you talk specifically about the food industry's obligation here, you talked about cross-collaboration. I was sort of curious, how do you measure success with something like this? If you're going to reduce sodium by a certain amount, you said, a certain percentage, where do those numbers come from? What are you trying to achieve, and how do you know that you've achieved it?
Yeah, I think it's a very good question, and it has to be, and you sort of hinted at the end, it has to be measured in very concrete performance by the industry, a demonstration that we're actually reducing these things. And for for things like sugars, which we're actively reducing. I mean, we have a good handle, we think, on those metrics. In our portfolio, we've reduced the sugar in our breakfast cereals, for instance, by nearly 20% over the last several years. And by this time next year, all of them will be at a single digit or less. And we're able to calculate that very well. We're on the verge of having trans fat completely off our ingredient list, and so across all of our portfolio, and so this is easy to measure. We've made very detailed commitments on sodium as an industry, and we've talked a little bit over the course of the week. Sodium is so ubiquitous; it can be a harder thing to measure. And actually, I think one of the issues is going to be to refine the metrics on sodium. But even having said that, the industry has announced a commitment to reduce by 20%, which is a very meaningful commitment over the next several years. General Mills is very much aligned with that commitment, and we're in the process of formulating to do that now. One of our challenges is consumers like these tastes, and they like products that have a salty taste or a sweet taste, and we need to, there's an old phrase in nutrition, it's only good for you it's only nutritious if you eat it. And so one of the challenges that we have is to make sure that consumers continue to like the taste of the products. It becomes, as Dick said, an innovation, a challenge for the industry, but we're very focused on doing this, and we're finding that we're able to formulate and still have products that people like and want to eat, but with significantly lower levels of sugar and sodium and trans fat.
Paul, you talked about one of the challenges of, like, for example, taking a cell phone and having it measure cardiac rhythms or do some sort of medical testing because it's got to get regulated as a medical device. So what do you do? I mean, how do you overcome a barrier like that?
So what we've been focusing in the developed markets where the regulatory burden is high, we're doing a lot of work in wellness as the first way in, so fitness areas. But then we've also worked with some groups. So there's an institute called the West Wireless Institute in San Diego, which was set up so that we could go out into the field, find people who were coming up with, say, a new sensor technology, and actually bring them in so that they could go through. It's associated with a hospital chain in San Diego. They can actually go through the entire process through clinical trials, because it's sort of something that a large company can do, but a small innovator has a hard time making it through the whole regulatory process. And so it's just a question of time scales. We start in the developed markets early with wellness, then move on to medical. And also we are trying to partner with a lot of medical equipment companies already, so they know how to do they know how to do these things. In the developing world, it's a completely different issue. And there, what's so interesting is that it's the wireless operators who have a very good day-to-day relationship with people in those countries. They're seen as very trustworthy, and they have a lot of assets to bear. They have people out in the field, they have call centers, and so what's happening now is that you can imagine that you'll have a lower-skilled person go out into the field and do data collection and transmit that information back to a call center where there might be a nurse, a more skilled one, a doctor, and so forth. So you can imagine the productivity gains you can get, and also the ability to scale and get that out there. And because the regulatory burden is not there, we think that we can demonstrate efficacy, and we can demonstrate that these are actually self-sustaining economically, and then bring those cases back. And in fact, the World Economic Forum, I think, is going to be very helpful in terms of communicating the successes in those areas.
As chairman of Qualcomm, can you give the audience some sense of how big an industry this could potentially be?
Well, there are people who are talking hundreds of millions of dollars, hundreds of millions of wireless sensors that you might wear. So, this is something that will be a very large thing. When you talk about the number of devices out there in the market right now, there's 5 billion subscribers of wireless services right now. So if you think about that from a platform to scale education, and then if you can actually hook those up to other devices that might monitor your health, I mean, the numbers could be quite large.
I'm having a hard time seeing out there.
I was just going to ask Paul. I mean, does this extend to? We're talking about wireless devices and monitoring, but does it also extend to video and remote diagnosis and this sort of thing?
Right. So we have a thing that we've done in Peru where there was a clinic outside of Lima that was treating children with cleft palate, and that people would go out to, do the operation or treat the people. But the problem, after they get the operation, then you need to do the speech therapy, and they weren't able to do that at this remote clinic, so they ended up doing that using a 3G wireless link with video in the clinic, and then doctors in Lima. And so those kinds of telemedicine things are really prevalent now, and that's actually starting to be something that you see a lot in the developing market to extend the reach of the physicians.
Yeah. I think I have a little bit of a hard time today, but there's questions out there. There's mics. You can go ahead and just move the mic around if you wouldn't mind. I think there's one over here saying your name, particular organization that you're with, if you could as well.
Les Borishevich, Vice-Chancellor, University of Cambridge and former Chief Executive of the Medical Research Council of the United Kingdom. I'm really delighted to listen to the way the panel is actually trying to address this problem. However, we do have a single avoidable and preventable measure which will deal with the vast majority of these non-communicable diseases, and that is tobacco. And the fact is, IARC's data shows it's 40% attributable fraction of all cancers currently present, developing and developed country world. And the same will go for cardiovascular disease, a single avoidable factor. Yet we're seeing an epidemic of tobacco use in the developing world. Could I just ask the direct question? What measures would you be proposing to actually deal with this single preventable issue?
Sanjay, I got it. So I think this is an area where workplace programs can be very, very powerful, and I say that because I've seen it work within our company. We've been actively supporting smoking cessation for over 30 years, and we've transformed the company from one where people were smoking at very high levels to virtually no one smokes at General Mills. And I think that you would find this true at many companies. And these are programs that have been developed and tested and been effective across many industries over many years. They can be scaled and they can be transferred to developing markets and companies in developing markets, I think, with great effectiveness, and they really do work.
If you have a workplace wellness program, are you focusing on incentives to quit smoking or disincentives?
It's a little bit of both, incentives, disincentives, lots of help. I mean, we've found out what works over the course of the years. It's not just smoking cessation. It's helping people with other lifestyle choices around alcohol use. It's screening for cholesterol, and there are a variety of screening that can be done. It's all very inexpensive. These can be done and scaled in smaller companies, in emerging markets very easily. They're very effective for diabetics. If you are diagnosed as a diabetic at General Mills, we will reteach you how to cook. We will sit you down with a pharmacist so you really understand the medication you're taking to boost those levels of compliance as high as possible. This is a great win for the employee, and it's also a great win for the company because we keep people out of the hospital.
How many employees at General Mills, roughly?
35,000.
35,000. Dick, did you have something to add?
Yeah, just one added comment on that. I think the other part of that answer has to be around education, particularly back into students who are still in school. Because if you see some of the smoking issues that we have today in several countries, it's teenagers. And so the workplace is very important. We all have to do that. But you need education back into elementary school and secondary schools and make sure that the students and the children or the next generation don't even start smoking.
Julio, I mean, workplace wellness programs in Mexico, I mean, what sort of strategies have you seen work?
We need comprehensive strategies, and tobacco illustrates a general point about NCDs. We need to move from the idea of health policy in the strict sectorial sense to healthy policies that involve all instruments of public policy to promote health. The single most effective policy tool we have is to raise taxes on tobacco. That's fiscal policy. It's not the business of the Ministry of Health to do that, fortunately, to raise taxes. But it is his or her business to persuade the Ministry of Finance to raise taxes because that's the single most important intervention to dissuade young people from starting to smoke. And then you need the whole range of policies, the educational arena, the workplace engagement, certainly the smoking cessation. It is an addiction. But I agree. I mean, this is one area that illustrates the need for a whole new generation of preventive approaches that think about health not as a specialized sector of public administration, but as a social objective that requires the engagement of all areas of public policy, of industry, and very importantly, of civil society.
This question over there.
Yeah, hi, my name's Paul Hogan, and my company is Home Instead Senior Care. And I wanted to just mention that, we have a very rapidly aging society, worldwide society. And about 35 million people have Alzheimer's or some other form of dementia. This will triple within 40 years to about 115 million people. And I just am curious to hear from you how Alzheimer's and dementias fit into your non-communicable disease sort of priority list, given the fact that it costs about 4 times as much to care for a senior with Alzheimer's than it does to care for a senior without Alzheimer's. So your remarks, please.
Well, certainly from a pharmaceutical industry standpoint, Alzheimer's disease is right at the top of the priority list with some of the other chronic diseases we're talking about. And several companies have several programs underway that hopefully over a period of time we'll see some success. It's been very difficult, as you know, though, to see a scientific pathway forward for dementia or for Alzheimer's disease, but it's certainly something that the industry is investing a lot in from an innovation standpoint, both from a diagnostic standpoint and a cure standpoint, but hopefully someday from a prevention standpoint.
Let me ask you a little bit more, more generally, Mr. Clark. As a pharmaceutical exec, how do you sell the concept of prevention to your company, to your board, to the people who invest in a pharmaceutical industry? Prevention seems like it would be at odds with what you do.
Well, it comes back to the mission of the company. And so if the mission of the company is that truly medicine is for the people and you want to make people's lives better from a health standpoint, and the best example I can give you is our cervical cancer vaccine. We want to prevent cervical cancer on a worldwide basis. So developing a vaccine that saves lives is why we're in business.
Let me just go back to the question about senior care. So there are a number of companies now that are building devices which seniors can wear that'll do personal emergency response services. So today, some of these things are out in the market that are in the home, and they'll do fall detection and so forth. Now we're putting wireless, cellular communications into these devices, and so people can get out of the house and still be tracked if need be. If something happens, they can press a button and communicate with the monitoring center. The other thing that's also going on is we have a program in Seoul where distributed devices that have cameras in them and two-way communications, and there's a set of people who then go out and visit with the elderly and then can communicate with them and keep track of whether they're still moving around. There's actually an IR sensor on this device too that makes sure that people are actually walking through the room and these kinds of things. So there are programs in place. People are trying to innovate around this idea of how to take care of seniors and provide them with the ability to retain social interaction.
Francis Collins, Director of the United States National Institutes of Health. I want to say how much I welcome this session at Davos and the focus on non-communicable diseases being the most rapidly growing area of morbidity and mortality in low income as well as middle and higher income countries. I want to make a comment and then pose a question. The comment is that it does seem if we're going to be successful in this area, we really need to build capacity in the lower income countries where this problem is now very much in need of being addressed. The Medical Education Partnership Initiative, which has recently been announced by PEPFAR and the NIH as a joint effort, will include non-communicable diseases in this effort to build capacity by training 140,000 healthcare workers and also providing resources for universities in sub-Saharan Africa to build research capabilities. And so I think the point here is to try to be sure that we're not coming up with solutions that will impose upon lower income countries ideas that we think will work, but actually to encourage those solutions to come from within, especially when it comes to prevention strategies. The comments about workplace involvement in terms of tobacco cessation, well, those are great if you have an organized workplace, but an awful lot of the places that we are now hoping to reach out to are not going to be in that situation. So I'd like to ask the panel your view on that in terms of what should be done about this, in terms of higher income countries making a strong effort, which I strongly endorse, versus also making sure we're empowering the low income countries to have some of that capacity themselves.
Secretary General, do you want to address that, the capacity of some of these lower and middle income countries?
This non-communicable diseases are related with human lifestyle, and therefore it may not be necessarily happening in low-income countries. It is happening in both developing and developed countries. But it may be the case that in developed countries they have a better capacity. But there are many ways, even in underdeveloped countries, low-income countries, the government and the people themselves, they can address these issues by changing their lifestyles. When I was a young boy, the perception in Korea or in Asia, they had the perception that the business CEOs, rich people, should be rather fat people. There were no such, very slim, healthy-looking business CEOs. And generals, military generals, policemen, they used to be all fat, nice-looking. Even women, the criteria of beauty looked round and a little bit reasonably healthy-looking women. Now, the concept has changed. You will never find any successful CEOs, any successful generals or policemen, government officials. They are very healthy, slim. That's what's happening. By changing their lifestyle, by working hard, by becoming more active, then government can do it easily, even in low-income countries. For example, why then this non-communicable disease or chronic disease happens in many countries, like much sodium or sugar or alcohol, tobacco? This is now changing, even in developing countries. And ministries, like finance ministries, they can make it life harder for those people, lazy people, to change, stop smoking by raising tax or educational. Now, in developing countries, there is a high level of attention in investing in education for young generations. They always can educate young people. Now, I heard from CEOs, the workplace policy will make a great difference. That is quite important practice and policy. I hope these CEOs, many CEOs, will continue to do more in making their workplaces much more conducive for improving their health. The United Nations or government as a whole, in general, can make policies, but they cannot do it alone. They need support from business communities, they need support from academia, they need support from NGOs, educational institutions. I think all should work together. Now, when I became Secretary General, I began to understand that many millions of people were dying without being given much attention. We have paid much attention and investment in preventing HIV, AIDS, polio, tuberculosis, and smallpox. As I said, smallpox has been eradicated, and we may be able to eradicate on this earth the polio. There are only 4 countries in the world. where we can see still polio exists. Then malaria, we will be able to see zero death, malaria-related zero death, death zero. We may not be able to totally eradicate malaria itself, but if MDG is realized by 2015, we will be able to do that. That will be much beneficial to developing countries. Mostly malaria is happening in Africa and poor countries, Southeast Asia. Therefore, United Nations is trying to raise this awareness politically. Then this awareness, political awareness, should be supported by all of our academia and business communities and the civil society. This is what I can tell you at this time. Thank you very much.
Thank you. And Dr. Frenk, I mean, is there anything else you'd add to that specifically with regard to capacity in some of these lower middle income countries?
I think it's a fundamental issue, and we've been divided in the public health arena between vertical programs that focus on specific diseases and horizontal that strengthen health systems but without any clear sense of priorities. I really think we need to find a diagonal approach in which we use a number of specific priorities to drive the general improvements and build the capacity so that when we are successful, as the Secretary General was saying, we have left behind the capacity to deal with the next challenge. Because a big part of what we're dealing with is the consequences of success. And we need to create that dialogue with the communicable disease community that, a lot of this is the consequences of success. The fact that there's no more smallpox means that a lot of the thousands of children who used to die and people who used to suffer disability from that now are living long enough to develop some of these diseases. The 5.5 million people who are now on treatment for HIV/AIDS will now live long enough to get diabetes or cancer or heart disease or dementia. The only way we can deal with that is keep our focus on the priorities, but use those to drive capacity building. And I think the emphasis that the NIH and PEPFAR have put through the Medical Education Partnership Initiative, the MEPI, that Dr. Collins just referred to, is exactly the sort of capacity. We need to build a new generation of health professionals that are better trained to deal with this set of challenges. I mean, to me, we need that kind of capacity, and I expect that if we do that right, a lot of the innovations we're talking about are going to actually first emerge in developing countries, like what you were talking about, in the use of mobile, of mHealth. And we may even be, in less constrained settings, setting examples that can then bring some important lessons to rich countries in how to handle some of this technology. Because we're not going to be able to deal with this tsunami of non-communicable diseases by following the same path that currently developed countries followed. We need to innovate in the delivery, innovate in forms of coverage, and have a comprehensive view towards disease prevention and health promotion. And we may generate innovations that can be valuable in feeding back to the rich countries.
I think there's a question over here, if we can get a microphone over here. But let me ask you while we're waiting, Dr. Frenk, following up on that, you talked about myth number 2 being infrastructure and not being there. With infectious diseases, it seems like a little bit more of a concrete formula. You have someone who has an infectious disease, you can get them the appropriate medications, antivirals, whatever the medication may be, and make sure that they are compliant with those medications, and you can treat. Someone has a complicated cancer, for example, and they need diagnostic testing, CAT scanning, MRI, whatever it may be. They need treatment, they need follow-up. It does seem like it would pose a much greater infrastructure challenge to try and address some of these types of non-communicable diseases in remote settings. How are there success stories where you can point to where it's actually being done?
Well, actually, I think the communicable, non-communicable divide is not the most useful one. It's very useful from an epidemiologic point of view if something is contagious. But when you look at it from the health system's point of view, the relevant issue is that they are chronic. And you have chronic communicable diseases. AIDS is the best example. But, we have heart disease coming from Chagas disease or rheumatic heart fever. A lot of communicable diseases actually produce some of the diseases we are dealing with. Some of the cancers have an infectious origin, like liver cancer and cancer of the cervix. So it's really the chronicity that actually unites this agenda and therefore creates less of a divide than we might think with the world of infectious diseases. Because the challenges of dealing with a patient with HIV/AIDS, where you need to have a person on therapy for the rest of his or her life, the questions of compliance, the possibility of innovative uses, first of all, of the drug delivery itself. I mean, we made enormous progress in packaging drugs in a way that makes compliance better, and then using mobile technology for those purposes. Those lessons are applicable for diabetes care, where you have a similar situation, or for many cases of cancer care. I mean, the one example I can tell you in a minute is the one in Mexico. We are now in the midst of this huge health transition where non-communicable diseases are the biggest burden, and it required a comprehensive strategy on three pillars. The new generation of health promotion and disease prevention strategies, assuring financial access by introducing universal health insurance, and we must not forget that these diseases are a major cause of financial catastrophe. But this year in Mexico, there will be 50 million people covered by a new insurance scheme, and we will achieve universal health coverage. And I can tell you that a woman with breast cancer in the poorest community in Mexico can now have access to the exact same treatment that my wife had when she had to deal with breast cancer. So focusing on the financial protection and introducing universal coverage is very important. And the third is innovations in delivery, mobilizing the sort of things you've heard about in the food industry, in the pharmaceutical industry, in the telecommunications industry. Mexico is dealing with this, has universal coverage for substantially less than 7% of its gross domestic product, which is much, much less than developed countries are spending. So it can be done. We just need to have a comprehensive approach.
And I think Dr. Chan, head of the World Health Organization, oh, there you are. Please, yes.
Thank you. Thank you for giving me the floor. I've been waiting, along with many friends and colleagues, and Dr. Sanjay Gupta, Mr. Secretary General, and distinguished panelists. I want to thank the World Economic Forum for taking this very important issue and giving it the plenary session that it deserves. It should have been done yesterday, maybe, but never too late. The reason I'm saying this is because the statistics is, overwhelming. NCD, non-communicable diseases, trump all deaths from communicable disease as well as injury. And I'm happy that, this issue is taking the limelight it deserves. And of course, there are many countries who are organizing very important events, culminating to Mr. Secretary General, the UN General Assembly discussion and debate in September. And one will be coming up is in Mexico. The government of Mexico will be hosting a regional committee meeting on non-communicable disease, to be followed by another one in Moscow, and the list is very long. So thank you very much. I think 2011 is the turning point for non-communicable diseases, which deserves all the attention. Now, talking about prevention, I'm happy to hear many colleagues talking about prevention. Precisely, this is an issue. This is a topic where prevention fails in other sectors. And the health sector becomes the receiving end of failure in all policies. So this is an issue where the health sector alone cannot turn off the tap. We need you. We need every sector to work together. Education, trade, as well as, what is the government policies? Do they provide a healthy environment for people to make wise choice and healthy choices? And I'm happy to see the food and drink industry is here and the pharmaceutical industry here. You have a big role to play. Notwithstanding, the difficulties with prevention. What about the people who are already sick now? Sick with diabetes, heart disease, and the list is long, and I heard about Alzheimer's. I'm happy to hear this. But let me propose critical priority, as Julio, my good friend, was mentioning. Tobacco, we must fight it. We cannot allow tobacco to cause all this death. This is one industry that is created to kill its users. I have never seen anything that is allowed to kill its consumer, like tobacco. Second thing, innovation, we support it. We would like the food industry to continue with your efforts, self-regulation on not marketing food to children, as well as reformulating your products to get rid of all the things that cause disease. And likewise, the pharmaceutical industry. Access to medicine is an extremely important issue. For those people who are having diabetes, having heart disease, having cancers, what can you do more to make sure that medicines is accessible and affordable? I have just had time to mention a couple, but I cannot finish without mentioning obesity. I'm so pleased to see you here, Ambassador. 43 million children, preschool children, are obese, and they have a strong link to diabetes. Please make sure we need to work with the education sector to reduce that tsunami of obesity. And why am I so passionate? For those of us who are coming from Asia, we know that diabetes is having a home run in India, in China. For some strange reason, we need to do more research. Asians, including Chinese, Indian, and others, when we don't get obese, I'm not obese. Even for putting on less weight, we have a higher probability of getting diabetes. And when we get diabetes, we die much earlier than Caucasians and Europeans. This is also an inequity, isn't it? But panelists, I want to thank you, and I want to thank the World Economic Forum for giving the very important issue its due prominence. Thank you for allowing me to take the floor for so long.
Thank you. And an hour flies by quickly, but Mr. Secretary General, I wonder if you had any sort of closing thoughts. And let me ask this way: when you have a forum like this here at Davos, do you know is there any way of telling what the impact of having this sort of discussion here will be?
First of all, I can tell you this has been very useful. It has given big impact to general society, so that everybody now understands the seriousness of NCD. United Nations, as Director General of the WHO has said, is taking this issue very seriously. I understand that this is going to be the only second major high-level meeting convened by the United Nations General Assembly only about a decade ago, the AIDS conference. This is a very unique, unprecedented initiative by the United Nations. And I myself will participate in this Moscow conference on NCD. Again, my role, I'm not the medical doctor, or I'm not the business leader, but my role, I believe, is important to raise, first of all, the political awareness around the world. This is what I'm going to do. The purpose is, first of all, mobilize political awareness and mobilize financial support, if possible. I'm sure that there will be wholehearted support from a business community and particularly food production companies and pharmaceutical companies. And at this time, I'd like to propose one thing. We need to, again, pay more attention on another area when it affects to human lives. Many millions of people are dying, of course, from infectious disease, NCD, now what is known as neglected tropical diseases. There are many people are dying from this. We need also pay attention to this, and particularly pharmaceutical communities and the research and development communities. Because they are so poor, they are not capable to buy expensive medicine. Thus, there is no incentive on the part of pharmaceutical companies to research and make medicines. So this is kind of cycle is not desirable. Now it's quite encouraging that we are paying heightened attention on this NCD, we need to make this world better for all, whether one lives in developing or developed world. The healthy society, healthy people makes healthy society and healthy world. Then by doing that, we can make our world sustainable one, sustainable development. This is a part of development. Therefore, my urge to you is that let us work together. We will lead you. We will be always in front. But I hope that you will always support the work of the United Nations, work of your government. Thank you very much for your commitment.
Thank you very much. Mr. Secretary General, Ken Powell, Chairman of General Mills, Dick Clark, Chairman of Merck, Paul Jacobs, Chairman of Qualcomm, and Julio Frenk, Dean of the School of Public Health at Harvard. Thank you very much, everybody.